Cut.
Okay, cut. You know, but the kid eating fries for breakfast, you know, that's like every kid's dream to get.
I'm hungry, by the way.
I'm quite hungry as well. But you know what? Like Malaysian breakfasts, most of them seem like full course meals at times, you know, because you can have your nasi lemak for you know, dinner and all of that. So it's something that seems like something else, but it's not really. Kind of like hippotherapy, because
Well done.
contrary to what, thank you Roshan, contrary to what you may think, hippotherapy is nothing to do with getting into the water with hippopotami. Don't even think about it. Hippos are very, very dangerous animals, so do not try that. But that's another topic for another day. Now, hippos is actually the Greek word for horse, and hippotherapy is therefore when a therapist uses horses to achieve rehabilitation therapy goals. All sounding like Greek to you, don't worry. With us today we have Dr. Ali Azman Minhaj, consultant pediatrician at the Ramsey Sime Darby Health Center and occupational therapist Nur Irdiana Idros to take the reins and discuss the topic. Welcome to the studio, guys.
Hi.
Doctor, first and foremost, it's fantastic, but could you just give us a proper definition of this process?
Okay. Actually, hippotherapy is a medical treatment.
Yeah.
It's a medical treatment where we use the horse movement,
Yeah.
by the therapist.
Yeah.
These are basically qualified physiotherapists,
Okay.
occupational therapists, and speech therapists who use the movement of the horse
Yeah.
to treat and rehabilitate handicapped children, actually.
Oh.
I'm just wondering, is this an adjunct therapy, or you know, has it been around for a long time?
All right. Now, this therapy has been a long time, since even before 5000 BC.
Oh, wow.
The Greek has been using it to treat the injured soldiers using the horse. And then in Europe, the idea has been picked up very, very aggressively since 1960s.
Okay.
And the US and Canada start picking it up since 1970s. So it is a very well-established medical form of treatment, actually.
Okay, but in Malaysia, is it relatively new, you would say?
Well, I've asked a few, even some doctors, who don't even know what the word hippotherapy means. It's a bit pity, actually.
Okay.
But it sounds like it's been tried, tested, and it works. So going back to how it works, how does hippotherapy work?
Actually, the horse walks like a human being, exactly like a human being. If you see
wow.
horse walking from the back and a woman walking beside the horse,
Okay.
the swing of the pelvis is exactly the same.
Okay.
It's four-dimensional.
I'll be more observant
All right?
next time.
Okay,
Then.
so when you sit on a horse, as if you feel that as if you yourself are walking.
Okay.
So that's why it becomes a very powerful form of tools to help in the walking of patients and things like that.
You know, speaking of patients, what sort of medical conditions can hippotherapy contribute?
Okay, we are talking more on handicapped children actually now. Not only for children, but also for adults actually. People with strokes. Okay, these are very important. They learn how to walk faster and much more effectively. Right? And children, especially among the spastic children. All right, and those delayed development, delayed speech. You know, children with delayed speech, and even for children with abnormal behavior. Now we see a lot of children with autism.
Yeah.
These are the people who can really benefit from the horse therapy. Actually.
Okay.
But speaking about benefit, how does it benefit, like you mentioned, these kids with mental disabilities? How does that work?
Okay, maybe Diana will be able to answer that.
If we say about mental disability for kids,
Yeah.
so we will focus on autistic kids. It's autistic spectrum disorder. So when we talk about autistic spectrum disorder, it will goes to the sensory integration disorder. These kids, they have a sensory issue. They feel like the sensory is bombarded to them.
Yeah.
They can't even filter the sensory. For example, like now we are talking, you can focus your hearing towards my voice, integrated for other people's voice,
Yes.
other people movement. But these kids, when I'm talking to them, they can see people moving. They can feel all the senses. So they have this sensory issue. Like for example, we always say that I wish we had got 6 sense.
Yeah.
But actually we have 7 sense in the therapy program. Okay. This 7 sense, the 2 sense is proprioceptive and vestibular.
Okay.
Have you heard of proprioceptive and vestibular?
I'll be honest, no.
Yeah. Okay.
Could you explain what it is?
Okay. For example, we are sitting now. Without vestibular, you can't balance yourself sitting. And without proprioceptive joint sense, you can't even control your body to be seated on a chair.
Wow. Okay.
Okay. These 2 senses is the most important sensory in everybody actually.
Okay.
But for these kids, they can't modulate the senses to our lifestyle. For them, everything is bombarded. So what therapy does, we exchange the bombarded thing, become to like one by one. They can filter it one by one.
Oh, wow. Okay, so by being on the horse, this sort of aids them in focusing better, is it?
Yes.
And it has to do with the movement of the horse itself
Yes.
that helps with the focus. Okay, we've got a whole lot to find out about hippotherapy. We'll be right back. We're going to head off for a short commercial break. Stay tuned, guys. Hey guys, you're still tuned in here with us on VBuzz, and we're speaking about this really exciting topic, hippotherapy, or therapy with horses. Now, before we went off on the commercial break, we were talking about, you know, the vestibular and the perceptive. Proprioceptive.
Good try.
Yes.
Good try.
I
wouldn't
tried
have gone
it.
there, but good try.
I tried it. But, you know, I'm just wondering, are there any sort of physical disabilities that can be helped through hippotherapy?
Okay, when it comes to physical disability, we will look back for the cerebral palsy kids.
Okay.
These CP kids, they have spastic. Some of them are very rigid,
Yes.
the movement, the physically, and some of them are very floppy.
Okay.
So floppy
two
means
extremes.
yeah, it's one is very tight muscle, another one is very like soft,
Yeah.
Loose.
very loose, very, you know,
Flaccid.
like veggie.
Yeah. Okay.
So these kind of kids, people, when we say hippotherapy on the horse, people will think they have to be seated.
Yeah.
But actually, on the horse, they can be lying down, prone, supine. They can be lying down forward.
Okay.
There is few positions that we can deal with it.
Okay.
So before the kid learn how to sit, we will stimulate the muscle, the movement through the horse movement. It will stimulate on the horse. Basically, in the hippotherapy, we don't use saddle.
Oh, okay. So it's direct contact between
Yes.
patient and horse at the end of the
Yes,
day.
we use bareback. So it's a direct contact. Our muscle, our body movement to the horse.
Wow.
So when you sit on a horse, you can feel the pelvic is moving right, left, right, left.
Okay.
Basically, in hippotherapy, we are using the horse movement to help the kids. Yeah.
Because I always assumed that it was going to be on a saddle, but what's the prep like before you get a patient on the horse itself?
Okay, there will be a briefing. So in the session, there's not only horse, the kids and the therapist. There will be a side walker and there will be a leader.
But how do the kids react to the horse? I mean, you say they have, just say for example, they do have mental disabilities. Are they frightened or do you nurture
Yes.
them? How do you
That's
deal
right.
with that?
For example, autistic kid, they have this sensory issue,
Yeah.
especially tactile. Some of them, they don't like being hugged. They don't like to be touched.
Yeah.
Some of them, when we shake hands, they can vomit.
Yeah.
So
Okay.
with these kind of kids, how we approach them, we will make them to brush. I mean, tapping the kids. I mean, tapping the horse. You know, they have to pat. They have to like hi Tommy.
Yeah.
So they will introduce themselves to the horse. So we will like they have to like get, for example, bond to the horse.
So
They
it's
will-
the most basic form of interaction you
Yes,
start out with.
yes. They have to touch because the horse. There are so many parts of the horse. You have to touch the neck. They can hug the neck. They can
Yeah.
touch the mane. They can start touching the mouth.
Mm.
Yeah.
You know, speaking of horses, is there a specific type of breed of horse that's used for this?
No. Actually, the horse must be trained. Very important. It's not the horses, any horse can be done,
Yeah.
can be used. But they must be trained to create a proper gait, you know, suitable for therapy. So it's not ordinary horse. But any horse can be used.
But it has to be trained first.
Yes,
And
got to
speaking
be
about
trained.
training, the therapist doctor who execute these moves and all these things, what kind of training do they go through to help these children?
Okay, actually, hippotherapy is done by a team of people.
Okay.
There's a team. There's a team. First, there must be a doctor.
Okay.
Right. Why the doctor is very important? Because it is a prescription. It's a medical treatment. It must be prescribed by doctor.
Okay.
Very important, the doctor's role. Because the doctors will identify what type of child is this, whether this child is suitable or safe enough to be on the horse.
Okay.
All right, very important. So that's the role of the doctor. And the doctor will identify the problems which the child will have. And now he will pass the problem to the therapist.
Okay.
Now, this therapist like ear, I call her ear anyway. They are qualified to start with. They are graduate physiotherapists, occupational therapists, or speech therapists. So they must be that first. I mean, they are qualified to treat handicapped children to start with. So not ordinary people can do that. And then they will have to go under special training with the horses, how to treat children on the horses by using their knowledge on occupational therapy, physiotherapy, and also speech therapy. Okay, and then we have got side walkers. These are two people beside on each side of the child. Now the idea is to keep the activity as safe as possible. This is a very safe procedure. That's why we have two people there. Very important. And they also have got one person who leads the horse, and this person must be good on the horse. So we got a lot of experts there, just for one patient. That's so intensive. It's 4 things going on, looking after one person. And that's why they give a very intensive type of treatment.
So it's a lot of care and thought that's been put into this. But is it something that's very costly? Could you give us a rough estimate of how much a session costs?
Okay. For example, an occupational therapy session cost, it will cost you 120 to 150 per hour.
Okay.
Okay. So that session, you will be an OT with 1 kids in a room.
How long is the session?
45 minutes. So that is per hour. Another 15 minutes will be the discussion with the parents. So, but on the horse, there will be 1 therapist, 1 side walker, as the doctor saying, and 1 horse leader with a horse. So roughly, the session will be like 250 per session.
Per session.
Which it's still reasonable because there is 4 expert people there. I mean 3 people and another a trained horse. So basically the session will be like 30 minutes. 30 minutes on a horse. Yeah.
Oh wow, okay. I'm just wondering, because the doctor mentioned earlier that it needs to be prescribed. How many sort of prescriptions is there? Is there a length of it, or is it a one-off thing? You go on the horse once and you're done?
Okay. Actually, it's based on the research. Okay, for example, if you break your bones, if you just go for a session, a physiotherapy for once a month, and you go for once a week or every day, which one will effective more?
Probably the more, or the one more
The
often,
more you go for rehabilitation, the more you would be fast
to recover
quickly. Okay, so what we plan, it's 12 session, including the assessment in the middle of the session, 6 session, and then 12 session. So it's 12 session. So after the 12 session, we will recover back, we will call the parents, we will discuss all the progress, everything, and then we will recommend them if it's either they want to continue or we can discharge them, they can continue with therapeutic riding.
And how much time between the sessions?
We recommended them to come once a week.
Okay.
Once a week.
Well, I've just been looking at some really nice pictures and some really heartwarming pictures of the kids with the horses and so on and so forth. And if someone is watching this right now, could you give us like a case where you worked with the child or anybody for that fact and how it has benefited that person and how they've gotten better with this therapy?
Okay, we have got this one child who's physically handicapped, a 4-year-old who was not able even to sit well. Right? Whenever he start feeding, they just slop on the chair, things like that. So we put her on the therapy course. After 6 weeks of sessions, by the 12-week sessions, she's already learning how to walk.
My goodness, that is
and
fantastic.
that is within 3 months, which can never get outside treatment. Okay? Now, because you know why? You see, the horse walks 120 steps a minute.
Okay.
So in half an hour, there will be about 3,000 steps. All right? So each step, the child will respond to the movement of the horse. That is a form of exercise. So in other words, for one session, the child will have got 3,000 chances of building themselves up and learning, which can never get in a room setup. You see?
And I suppose that's when the nose saddle comes into play, because you get to feel the stimulation from each step. That's really, really, really cool. I'm just wondering, what is the most fulfilling aspect of working with your patients and hippotherapy at the same time?
Okay, for me as an OT, as a therapist, so the most fulfilling for me is when I see the parents smiling at me. And when the parents starting to tell me, hey, my son can do this. My son, for example, my new case. There's a new case. Within 3 sessions, he has a very dramatic behavior, very aggressive. Within 3 sessions, the parents came back to me, hey, Diana, you know what? My son can calm down, can listen to me when I say wait. So he can wait, because actually the bonding with the horse can make them become calm,
Yeah.
because they have to wait to be mounted upon the horse, and then on the horse they have to enjoy the movement. Actually, the movement of the horse really makes them a bit calm,
Yeah.
not a bit,
Yeah.
more calm.
Yeah.
Yeah.
You know, it has been really educational to hear these things, and hopefully we'll see this kind of therapy progress and become even bigger and bigger. Thank you both of you all for joining us and educating us on how these things can help everyone.
Our
Hopefully we
pleasure.
see a lot more of hippotherapy happening in Malaysia.